Hey, Kiara. Can you
Hey,
hear us?
yes, I thought I was muted, but I am not. I just don't have my video on.
How about now?
Yes, can you hear me?
I can. Yay.
Oh.
Good morning.
Good morning.
I sounded entirely too bright and cheerful there, even for my own ears.
All right, we're just getting things set up here. We'll get started shortly.
No. We've got an echo. That's coming through. Right, math workbook.
Yeah, you could work on your multiplication tables.
I could bring.
Morning, folks. We'll get started in just a moment.
You got an echo going, Jamal.
Yeah. Thanks. See if we can.
Is this better? Yeah. TV.
Okay.
But that was a superpower.
Just a
That was
moment.
superpower, buddy.
If you could put your name and organization in the chat, we're gonna take attendance for today. Okay, Bruce, whenever you're ready.
All right, good morning. I think you've all heard, we just want to put, oh, there we go with my video. We just want everyone to go ahead and put their name in the organization they represent in the chat. That way we will have a count on not only who's here today, for in the future when we vote on items, because we are going to be a little action oriented in the sense that we do want to be able to vote on initiatives and get things moving in our community. So welcome everyone. Good morning. Hopefully you're all safe and warm wherever you're at, because it is a bit chilly outside today, and it has been. And if you need allergy medication like myself, that it finds its way into your system today. So with that being said, do we have any member announcements from anyone today? I know this is the part where there's a lot of silence. Well, if there's no announcements from anybody, we are going to proceed, kind of keep things moving along. So the first thing we're going to do is we're going to start off with the co-chair initiative, which is the IDD initiative, and some draft recommendations. If we want to go ahead and switch to the next slide. So we're just going to kind of review some of the findings and kind of what we're thinking along the lines for those who may not have been able to read through the information that went out this last week. I think, Jamal, did you send that on Thursday, or when was that?
Oh,
It was earlier than that.
about a week and a half ago or 2 weeks
Okay.
ago.
Yeah, so we have sent it out, but we just wanted to be able to review it to refresh everyone's mind. So some of the key findings that we found was that 9.1% of children in the Marion Polk CCO were identified with ADHD, IDD, or ASD. And of those numbers that we could find and were given, it was 5,364 children. Some of the things that we did note as well: a significantly lower diagnosis rates for Hispanic or Latino / Latina / Latinx, Native Hawaiian or Pacific Islander, children with interpreter needs, and female children. Children with ADHD, IDD, or ASD, and their parents have a higher prevalence of behavioral health diagnosis than social or psychosocial risk factors. And here was one point that we kind of suspected, but was confirmed, that a significantly higher engagement in primary care and oral health services was found than children without the diagnosis of ADHD, IDD, or ASD. And they also had a higher immunization rate for those that were in there. So they are definitely being more active for whatever reason. So we kind of were looking at different options of how we could reach out and help this community. And for those who don't know Jamal, he's got a tremendous background in understanding the way things work at the state level, contract level, and kind of he's really helped me to really kind of put this into a coherent thought, so to speak. And so if we go over to our recommendations here, which is a little bit tinier font, but I have my glasses on today. So for a landscape analysis, we want to evaluate current screening practices for cultural and linguistic gaps and identify what steps are needed to implement more equitable practices across the Marion Polk region, and understand the underlying root causes for disparities, which we noted, which may differ at the practice level and across organizations in the region. And then what our action plan and budget for this, we want to contract with a consulting firm specializing in reducing health disparities. The consultant will conduct an environmental scan across a comprehensive representation of pediatric and primary care settings in the Marion Polk region. We're kind of estimating, or guesstimating, as I like to say sometimes, a shared budget savings of $40,000 towards this analysis. The time frame that we're looking at is to get this done between July and September of this year. And then deliverables on this, we're going to report on current screening and diagnosis practices, as well as the gap analysis and recommendations report from said consulting firm. Next, we want to move on to a family outreach and awareness campaign. Now, research shows early intervention before age 4 are associated with more positive outcomes over the lifespan of a child or person long term. There may be stigma, social barriers, and cultural barriers preventing access to early identification protocols. Outreach campaign will communicate available family supports and services and why early detection is important. So our plan and budget for this, we will conduct an outreach and awareness campaign towards populations with diagnosis rate disparities. Outreach will amplify existing support networks and groups such as Circles of Security through Early Learning Hub and the Oregon Family to Family Health Information Network through OHSU. We're guesstimating a shared budget savings of $15,000 to be moving towards that. Now we put down right now currently the timeline of July 1st through September 30th. I will say we may flex that a little bit considering we're still going to get analysis from the consulting firm of said groups. But our deliverables on this, we do want to be able to have, like we said, an outreach campaign consisting of flyers and handouts, social media outreach, and perhaps a local event presence with a 3-minute presentation, that we can apply to certain outreach events. So now this is kind of key here, and I hope I'm going to be able to state this right with what our hope is. So local screening and diagnostic workforce development. So supporting local teams of medical and education experts to provide early screening, diagnosis, and other supports for families in the Marion Polk region. We want to be able to leverage local and statewide experts for training to facilitate ready access to specialty consultants. So we want to partner with groups such as Salem Access, local community developmental disability programs, and other medical workforce development organizations to host a provider training event or series encompassing findings and recommendations from the local landscape analysis, create a local on-call specialty resource available for pediatric and primary care provider consultations. We're estimating right now for this $40,000 a budget to go towards this. And this one, we do see it'll be in the final quarter of the year for October through December. And what we want to do is we're looking for deliverables is facilitate lunch and learn trainees, some sort of CME possibly, Marion Polk Resource Library. And I think what we had said in our analysis of this is we want to be able to hopefully empower more local providers with provisional diagnoses. Something that will help us to move this along because we understand that we know we've been told numerous times there is a ginormous backlog when wanting to refer the IDD population to OHSU. So we want to hopefully empower local providers and be able to move things along here. Now, Jamal, if I remember our goal here correctly, we do want to vote from the CAP today. If we can get an approval that we will start implementing and working towards getting this moving along.
Yeah, and Bruce, I did note that we do have a voting quorum of CAP members, so we're good to go. I would open it up for any questions or comments before we ultimately motion to approve. Absolutely. I'm new, as you can just tell. I think a lot of us are new to this format of how we're going to be voting, but he is totally correct. Please, we're looking for some feedback here. Anything anybody wants to comment on, we would really appreciate it because we do want to make a difference, but we want to make a difference together. So
I've got a question. Oh, I'll wait. Go ahead. Whoever else that was.
Sure. Okay. This is Noelle. So I think I'm reading it and hearing it correctly. I just wanted to restate it, I guess, differently to make sure I understood. So step one is really making sure that we've mapped the current services. Because as I'm reading this and we're identifying a couple of the things that we already have in place, I'm seeing some things I'm aware of that are missing. So my understanding correctly, the first is just making sure we even know what's out there and available and that that's readily understood by our provider community. And then let's go and figure out what we do about gaps that are left on the table. Is that the gist in a very quick nutshell?
Yeah, that's a good gist.
Okay.
Yeah, and I think one thing to add there, Noel, is that initial landscape analysis is really focused on identifying some of the root causes of the disparities for different racial and ethnic populations and their diagnosis rates, and what's occurring with current screening and diagnosis practices that's leading to those disparities.
So the only thing that I guess I would comment on then with that, because that's where I was going next, is I think when you add that in, it just becomes a huge project then. So my only concern is that it becomes something quite large to try to tackle. And I don't know if there's, I mean, I like the breakdown, the way we kind of framed it, that there's timeframes to do the landscape analysis during this period of time, and then we kind of go to the campaign, and then we kind of hit maybe underlying disparity causes or how we approach that. So I think just keeping awareness around that as we approach it, because I think we could get lost in the vastness of this. This is a huge thing to tackle. I think it's a great thing to tackle. I'm happy to be a part of it. I just think making sure that we keep the bite sizes manageable will be important.
Absolutely agree.
And I had a question.
I
It's
just
Matt
had a quick
Hattler.
question.
Oh,
Oh, go ahead.
so my quick question about the last section here about the creating the local on-call specialty resource. I'm just kind of curious what the vision is for that. Is that like a developmental pediatrician that we can consult? Is that a place where we can send people a little more quickly for like ADOS testing? Because like for ABA therapy, they usually won't take them unless they have the official diagnosis. Like we can always do speech and occupational therapy referrals, but for ABA, that's something that's harder to get into, and they need that official diagnosis. So I just wanted to see what exactly is meant by the create a local on-call specialty resource.
Yeah, I can speak to that, Bruce. So talking with Dr. German, there was sort of a desire for a similar to Project Echo, so having specialty on-call experts who pediatricians, primary care providers could liaise with as they're engaging with this population in the clinical setting.
And I think, Jamal, you said you had a resource on it as well.
Yeah, so we have been reaching out to the local access team, which is part of the Oregon Center for Children and Youth with Special Healthcare Needs program from OHSU. So they have a team that is, I believe Dr. Suzanne McClintock at Chaos is the liaison for our region who we're hoping to connect with to identify what can be sort of that on-call specialty resource.
Does that help, Matthew?
Yes, yeah. I think there's still some fleshing out to be done, but yeah, that helps.
This is new. I'm sorry, my allergies are really bad today. I had a question regarding the findings. Were there any cross-sectional data relative to those with IDD and those who are foster kids?
We did not include foster kids in our analysis.
Okay, thank you. Okay, perfect.
Dr. Chaudhry, so Pacific Source did present at our February CAP meeting where they did present on some data relative to psychosocial risk factors. And I believe some of that may have touched on the rate of kids who are also in foster care or have a history of foster care. So we can sort of revisit some of those findings as well. Very, very rich data from the February meeting.
Okay, thank you.
Can I just clarify a
Caroline,
process
there you go.
question, Bruce? Yeah, just a question on, so are we voting to put this through to the shared savings committee for approval. I heard you say shared savings. Is that where we're looking to pitch this to?
I believe, Jamal, is that the direction we were going with this?
Yeah, so we don't necessarily have the formal shared savings process established quite yet. And so the request here is to send this initiative directly to the board of the council.
Okay, but it would be coming out of that shared savings budget that we've just had our first meeting on the
Correct.
committee for, is that right?
That's correct.
Okay.
Was there any other questions or comments then about the initiative? Right, and we appreciate everyone's feedback because these will be items that it's true, to more to Noel and Matthew's point, we are definitely still fleshing out. We're trying to be ahead of the curve though on wanting to start this initiative because we still have, what was it, a month and 2.5 months before we'd even be, the consulting firm would even be doing their analysis. And so we do want to, flesh this out a little bit more, but Jamal, I think, can we put it to a vote now, or does anybody else have any other comments on it?
Yeah, I think you're good to go, Bruce.
Okay, so do we want to do it through the chat? How do we want to do this? As far as, do we need to, verbalize? It's almost easier to document if everybody approves or disapproves in the comments section, but what is your thought, Jamal?
Right, I think we can just do verbal, and I'll sort of help with tracking voting amongst members, but if we want to sort of move to a motion to approve and a second, and then ask folks to either chime in with yay or nay.
So, and you need a committee member to make a motion, don't you?
Yes.
Right. So motion to approve.
Thank
If
you, and
need
I
if you need a
second.
second. Okay, yeah.
So we have an initial and we have a second. Now can we go through with the yays?
This is Krista with WBP. I approve it.
Russ Huffman, yes.
Matthew Hather,
Chowdhury, yes.
I'm a yes.
Sorry, I got Matt and Lavinia. Was there somebody else who chimed in there?
I heard Manu as well.
Thank you.
Sometimes it's easier to ask.
Yes.
This is Prashanthi, WFMC Health, yes.
Noel, yes.
This is Caroline King, yes.
Oh, and I see other people commenting in the chat as well, Jamal.
Got it. Okay.
And I guess it doesn't have to be one after the other. If anybody feels the dissenting vote, that please chime in as well if there's any no's.
Okay, Bruce, I think we've got a unanimous vote of approval.
Well, we want to thank everyone for voting today. And we know that this format is new, and I'll probably stumble through it on the next time we do it, but we will try to continue to keep moving initiatives along through the CAP. And so with that being said, I think this segues great, Jamal, into our review of the 2024 CAP Charter, which we want to kind of update and keep things moving along in that direction so we can let everybody know. And then at the very end, I know that you and Naomi are going to update everybody as well on the progress we made with the shared savings group as well, and all sorts of standing agenda items. So were you taking over at this point? I don't remember.
Yeah, I'm happy to go over some of the key changes to the charter. So, as we just talked about in the previous section for the IDD recommendations, CAP has new spending authority relative to the shared savings budget that's been allocated. And so our new charter, which you will have all received with the meeting materials, emphasizes that new spending authority and effective decision-making on financial allocations for this body in section 1. Section 4 aligns future CAP membership with the duration of the Marion Polk CCO contract. So ensuring that this body and our members and the wealth of knowledge that you all bring extends for the period that we're working with the local CCO in this region. Section 7 really introduces new meeting procedures, as Bruce took us through a moment ago, that keep us in alignment with CCO requirements for CCO governing bodies, which the council is when making substantive decisions. So these are procedures such as formal minute tracking and recording of meetings, and some public comment requirements, which we'll likely be introducing at the May session. So section 7 goes over some of those new meeting procedures that keep us in alignment with that rule. And then section 8 introduces a little bit more structured project planning in the event that the CAP decides to establish a formal subcommittee. So I'll turn it back to you, Bruce, or open it up for any questions or comments on the 2024 draft charter.
May I just add, with this change, it becomes really important to attend the meeting. We're becoming a decision-making body, and we will need a quorum to vote, which is 50% of the members plus 1. And your vote is also important for moving items forward.
Thank you, Naomi. And I do see today that we do have a nice attendance number. I usually look at us and I see when we're past the 21 or 22 mark, we're pretty good. Today we've got 26 participating. And then I believe Josie and Justin count over there as well. So that's even more on that list. So yes,
we're just bystanders.
Okay, bystanders. Well, participants nonetheless, though. So
yeah,
I appreciate Naomi pointing that out. We've really set our goal for this year. We do want to be more active in engaging all of your expertise, and then using that expertise to help us to, move these initiatives along and move our community along. We really have an opportunity now to be kind of in a rather than a discussion mode, a discussion and action mode right now. So please, share your thoughts, share your expertise, because we truly do appreciate
it. Bruce, shall we take a motion to approve the draft charter?
Yes, I motion to approve the this CAP charter, and we need a first and a second, and then we can vote on that as well.
I make a motion to approve as well. This is Manu.
Second, this is Russ.
And then I vote a yay.
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 Yeah.
Yay from Lavinia.
And I see 5 yeses in the chat so far.
Yes, from Naomi.
Don't forget, if you do have a nay, that is fine as well. And if nay and yay sound too similar to you, it's okay to say no or yes.
And do we have any abstentions? Seeing none, Bruce, I think we've got a unanimous approval here for the new charter.
All right. Now I believe it is Naomi's turn to take on over and take us through the rest of this meeting.
Thank you, Bruce. We are doing great on time today. So next on our agenda is social emotional health aspects of kindergarten readiness. Over to you, Brittany and Kiera.
Hi, everyone. Thanks for having us. My name is Brittany Knowles, and I am the Community Quality Coordinator at Pacific Source. And one of my main roles is to work on the health aspects of kindergarten readiness metric. And as Naomi said, I did bring a few friends along to help share about the metric. And I think I see Kiara on, but a few others as well. So I'll pause for a moment and let them introduce themselves and their roles as well.
Good morning, everybody. My name is Lisa Harnish, and I'm the Executive Director for Marion and Polk Early Learning Hub. It's great to see everybody.
My name is Kiara Yoder, and I'm the Health Systems Manager for the Marion and Polk Early Learning Hub.
And good morning, my name is Sasha C. Clay, and I am the Program Operations Associate at the Marion and Polk Early Learning Hub.
So thank you to our Early Learning Hub team for coming and sort of supporting this conversation. I think it's important to share as we sort of move into talking about this metric, how this metric is really different than a lot of the other downstream metrics that we have seen in the past. And I think just the Early Learning Hub showing up really illustrates the collaboration that happens sort of across the system in terms of this work. Jamal, are you advancing the slides? Would you move us on to the next slide, please? Thank you. The intention of the social emotional health metric is really to address some complex system level barriers that happen across many different sectors to support children in addressing their social emotional health needs so that they're ready to come into kindergarten, ready to learn. And part of the activities that happen within that work is our ability to or work on building capacity within the CCO to enhance the services that we offer that support social emotional health. Next slide, please. Jamal, thank you. What I wanted to sort of share with all of you is the difference, sort of how this metric looks different than some of the other downstream metrics. So as opposed to having really like that outcome be sort of like that numerator and denominator, we're really looking to attest to the completion of 4 activities throughout the year. Component 1 involves reviewing data that comes from Oregon Health Authority, and that data really outlines the health complexity and social complexity of our members 0 to 5. We also have an opportunity to complete an asset map, which I think aligns with some of the work we were talking about earlier this morning. Our asset map really outlines our social emotional health providers in terms of healthcare in our system. And what we're really able to do is we're able to look at our specialty behavioral health providers and also our integrated behavioral health providers that are providing support to children 0 to 5 in the system. And we do this through, sorry, just one moment. Okay, sorry. We do this through a survey and through interviewing providers, reaching out and sort of chatting with people to learn a little bit about the services they provide, what languages they provide services in, and what their capacity is to serve this age group. We also work really hard to engage the community, to gather feedback about sort of experiences for children 0 to 5 in meeting their social emotional health needs. We do that through coming to meetings like this. We've also attended the Parent Advisory Committee through the Early Learning Hub. And we also have our Kinder Connect sessions that we host quarterly, which we've had great attendance to. And that's allowed us to really share out some of the data that we've learned and some of the information we've learned from our asset map. And then we're able to sort of connect with the community and hear anecdotally what some of the barriers are for folks in accessing services that really support social emotional health for children 0 to 5. And we'll share I can share a little bit about some of the feedback we've received from the community, but as we've engaged the community, we've been able to pull together folks from all different perspectives. So through our Kinder Connect sessions, we've had medical providers, behavioral health providers, education providers, parents, all sorts of folks come together and just share about those experiences. And that's really allowed us to develop an action plan in terms of the work that we want to complete this year. And that's what we came here to share with all of you today. Next slide. All right. So as a just sort of a reminder, all of the goals on our plan and the strategies are really informed by the data that we received around sort of areas where we're serving children well and areas where our system could do things a little differently. And then also sort of the feedback from our community in terms of what they really wanted to see or what they felt would help serve this age group better. One of the goals that we created with feedback from everyone, the community, is to offer 3 or more educational opportunities for providers across the system. And I think it's important that we really sort of identify that and define that when we talk about providers in terms of this action plan, we're actually talking about across sectors, right? So we're talking about medical and behavioral health providers, but also childcare, early childhood education, sorts of folks. And we want to complete the offering of 3 or more educational opportunities before the end of 2024. And I'm going to share sort of just a couple of highlights in here, and then I'm going to turn to Kiara, who will share a little bit maybe as well about some of the plans that we have for the year. Kiara or Lisa, whoever wants to sort of take that piece. But one of our hopes is to collaborate with the Health Council and the Early Learning Hub to offer some form of training in an evidence-based practice for providers in the community. And we're still sort of working out what that plan will look like. We are intending to host a few focus sessions in May, which I know the information will go out to all of you. If you're interested in participating, we would love to have your feedback around that. But the intention is really to identify maybe sort of like a lunch and learn opportunity that really supports building knowledge around supporting the social emotional health of young children. So that's one sort of focus area within this goal that we have to provide more education. Kiara, I wonder if you want to sort of also talk about the other added layer that we've added into this work.
Yeah, and Lisa, jump in whenever. So we're looking at the social emotional screenings and assessments that are being done currently and in the region. And I'm curious from you providers at your clinics. If you could put in the chat box what it is that what screenings, if any, you are currently doing to assess the social emotional health of your children, specifically ages 0 to 5. This is an early learning metric. And so if you could put in the chat box, that would be fantastic. We've got some data from previously, but I'd like to make sure that what we've got is still up to date, and we may be reaching out to you as well. So as you know, there were previous work done with social emotion, or rather with screenings for the ASQ 3. And so one of the screenings that is available to do is the ASQ SE, which is ASQ Ages and Sages Questionnaire Social Emotional. So that's one, but I know that there's some others. And so we'd like to make sure that there is more, because we know that this particular age group is a challenging age group for 0 to 5. And so want to make sure that there are plenty of supports available. And so we'd like to know what is currently available to know what to offer people. Lisa, I don't know if you want to add anything on.
Yeah, I would just say as part of this work that we're collaborating with Pacific Source and the Health Council on is looking at our community partners where children are, such as childcare or with families, to make sure that families know about and are able to get children referred into various services. Which could be doing this obviously in collaboration with our health partners and helping to get families to services such as the Willamette Education Service District or other social emotional supports. So this is part of some other work that is happening alongside you all as health partners. The other portion that we'll be working on is working with family navigators to help to support families as well, and working with our childcare providers and our preschool providers. So I think what we're trying to articulate not very well this morning is sort of these concentric circles of supports for families, and all related to health and social emotional learning for children.
Thank you, Lisa. And then I'll move us on to talk about our second goal, Jamal, and just highlight a couple of areas here. I think while goal 1 was really centered around training for providers in the community, what we heard during our community engagement sessions was this real need to support parents in navigating a very complex system that feels really confusing and overwhelming for folks at times. And in that work, our intention to do is to promote sort of some of the care management and care coordination efforts that are already happening in our community. I think one of the things that we learned is that not everybody knows that that's a resource available, right? But we're also working on strategies that allow us to do maybe some additional outreach and support for families who maybe wouldn't have reached in to connect for that support. We're also working out sort of a strategy around public health messaging. We have some really, I think, interesting and innovative proposals on the table around how we could outreach to some of our communities who we saw maybe had less access to these social emotional health services. And then we'll also sort of be pairing that with an opportunity for parent education. And so what that what our intention that could look like is a parent education opportunity, then paired with sort of like an outing that's family centric and is really offered, I think, too, in other languages for folks who need that sort of support. And then, as always, sort of continuing that advocacy for the THW workforce. And I think, Lisa, you also kind of hit on that a bit as well. Not sure if Lisa or Kiara, you have anything you want to add in terms of this goal?
I'd like to add one if it's okay.
Yes.
I just want to add a comment because this reminds me of the work being done by one of the CAP work groups for the childhood healthcare access. So there's a group working on making sure we supporting access and referral pathways, but the target audience is all the partners who don't know about each other. And I see this one, the target audience is the community that are using the services. And I'm just glad to see Kiara is part of both. So there is linkages between the two, but just a reminder that we could align courses if this is related and make sure that, I mean, there's a part for outreach and education campaign as well from the breakout group. And I see that this is also around advocacy and connection to traditional health workers. I see some similarities between the two.
I definitely agree. Yes. And I think that's sort of the intention, Naomi, for Kiara and I to participate in that group and sort of have opportunities where we can link up in this space and that space and sort of align where we're able to. I think that's a great observation. Thank you for sharing that. Are there any questions?
This is Manu. I don't have any question. Just wanted to make a comment that at the Metrics and Scoring Committee, for which I have the privilege to serve as vice chair, we had OPIP come and give a presentation, and so it's really nice to see that what's being supported and presented here, at least from the target areas and the desired outcome, are also being discussed at the level of the state. So it's good to see that alignment between the information that we're reviewing right now and the information that was reviewed, I think, at last month's meeting, not this month's meeting. Of note, though, something that I had raised at that time, and I think Dr. Sellers has also integrated and placed it within the chat, is that, you know, when we really think of touching everyone, it would be great to have all healthcare providers have that ability to screen, particularly for the 0 to 5-year-old. And so beyond engaging in physical healthcare providers and behavioral healthcare providers, if there's any type of support that can be provided to the dental providers, you know, to learn about these things, to learn maybe even a toolkit with how to integrate it using a community information exchange when someone has been identified, and then referring appropriately. I think that would be a great step into that future. I had an opportunity to listen to attend National World Health Conference last week, and I heard Dr. Chalmers present, who's the chief dental officer of the country, and she said that 29% of all Medicaid beneficiaries only go to their dentist, and they don't seek care with their physical healthcare providers or behavioral healthcare providers. And so I feel as though that by not integrating all healthcare providers at the table for this assessment and these referral pathways, we're essentially removing ourselves from those 29% that do engage with care. So, but either overall, really nice to see alignment with the state on this.
Yes, and thank you. I appreciate that observation about incorporating dental providers as well. My hope is that as we sort of move into these opportunities where we can do these focus groups and learn about training needs and sort of like guiding what those opportunities can look like, we would love to have dental providers participate in those spaces as well and sort of share that insight in terms of what would be most helpful. But I appreciate that observation. Lisa, you had your hand raised.
Well, I did, I think you kind of said generally what I was going to say. I'm super excited to hear about that dental connection because I think that is an area that we haven't yet really brought into the circle as the circle, quote unquote, that we really need to. And so part of what you're hearing too is I think, you know, this are needing to develop the workforce in a lot of different ways about what to look for and then also where to connect families to. And likewise, I think there is that part of how do we help ensure that all of our families see and understand all parts of the health system itself. And so that we're encouraging families to get to the dentist, to get to their healthcare provider, to seek behavioral health, and that we're all coordinating these efforts. And Memu, I would also just say, you know, this work that we're embarking on, I think in our region, we have really laid a lot of good groundwork for this, specifically through a lot of partnerships that we've had over the years with the Oregon, with OPIP specifically. And when we think about those referral pathways into ESD, when we think about identifying where our target populations are that we really need to focus in on. So I would say all of these are really informed and based on that work. So I'm glad you saw that.
This is Krista. I have a quick question on goal 1. Is it planned that there will be CME credits for the proposed provider trainings that you guys are thinking about?
I think that's a great question. I think that that's definitely a consideration. And I think the challenge to know is that we haven't selected a training, right? I think the first step is really sort of assessing what providers need and are interested in, and then sort of seeing how we could pair that with CMEs.
And this is Manu again, and in line with educating providers, Capital Dental Care can provide continuing dental education units for any dental provider that undergoes and then can acquire it that way, so that we can have or create an opportunity for all the dental providers here to engage more and learn more from the system. And then also wanted to share that as educational opportunities are identified, you know, through work that's done with ENDS, and if Dr. Sellers is open to it, as well as many other IDD focused providers or Capital Dental Care providers throughout the state, maybe we can look at building a more robust training that can essentially better inform all healthcare providers, not only dentists, but then also with physical healthcare providers and behavioral healthcare providers, with really breaking down these clinical silos that exist between each of us. So, for example, on the physical healthcare provider, CME, maybe we could have a dental provider, maybe like Dr. Sellers or others, that can also speak for about 5 minutes or so about the interconnectedness and the integration between how all of these things are connected, just to bring more awareness at the healthcare provider level.
Those are great ideas and great thoughts. Thank you all for sharing.
Sorry, Dr. Seller, for volunteering you. Hope you don't mind. Please don't be mad at me later.
Just add one more to my many, many items.
We'll do it together, Dr. Sellers. We're always here for you.
Well, Jamal, I think I have one more slide here if you want to advance forward. Just sort of some opportunities to get involved. I mentioned we'll have our focus group opportunities. We'll be offering 2 sessions in May. I'll forward the dates and some information to Jamal, and he can send that out for you guys. I think we'll be offering one sort of early morning opportunity like this, and then one evening opportunity as well, so that folks can attend and sort of inform what that education opportunity will look like. And I know you guys also received a flyer for our Kinder Connects event that is tomorrow, 12 to 1. That will be hosted on Zoom. Super exciting event. If you all can come, we'll be sharing, I think, a little bit more in depth about our action plan with a little bit more time to sort of dig in and chat about it. And there will be other folks there as well from maybe like the education side. I think we will have a parent or two there, just a more robust audience, I think. And then down the road, we'll be offering some informational sessions as sort of the metric information for 2025 comes out as things shift in this space to a child level metric. Otherwise, please reach out, contact me if you have questions or if you just want to chat a little bit more about the action plan. And I think Jamal sent you guys our full action plan as well. So I'm happy to talk through anything you see on there.
Thank you, Brittany. And thank you, Lisa, and your team from Early Learning Hub as well. This is exciting work. Just checking if there are any other questions before we move on. I think we did the questions throughout, so we will move on. Thank you so much. All right, we have 6 minutes for a few standing agenda items before we close. We'll start with the Childhood Healthcare Access Workgroup update. So reminder that this work group has 2 breakout rooms, and we will be expecting 2 budgeted proposals that will come to CAP in the near future for us to vote on. The first one from the 0 to 5 breakout room, they are working on a few things. One is lunch and learn for partners, including doulas and clinicians. This is aimed at improving awareness of doula services and other referral pathways. The aim is to have 1 virtual lunch and learn and 1 in-person lunch and learn, and the in-person will also be a networking opportunity for partners. This breakout room is also working on outreach and education campaign for home visiting programs that exist in the region. And then we have a second breakout group that's working around immunization. They did a lot of work around coordination of School Exclusion Day this year. They're updating materials to prep for next year and planning to try and start this work earlier, potentially starting around the back to school time. And then the focus is being shifted to immunization coordination for the region, making sure that we can improve communication between the databases. And also there's work around finding an FTE in the region that can help coordinate access to immunization for the region. Next slide. All right, we have other standing agenda items are the CAP Shared Savings Work Group is active. They had a meeting on April 17th where they provided input on the proposed shared savings request. The next step for this work group is to finalize proposed shared savings request and review process, and this will come to CAP for approval and voting. Other updates and reminders, please complete and return your signed Willamette Health Council Conflict of Interest form by May 3rd. This group is now a decision-making body, and we're becoming a little more formal than we used to be, and we need conflict of interest form back. Also, I think Brittany already announced this, the Kinder Connects event is tomorrow at 12 p.m. Please chime in. And then the Salem Area Gun Violence Prevention, we had a request for a discussion on this at the CAP meeting. This will be coming up at a future agenda for CAP. And also discussion on the Marion Polk Community Health Assessment Forces of Change will come to the CAP meeting in July. And we have 2 minutes left. I believe this was on next slide, just in case there were other standing items. Don't think there were. Was this the last slide, Jamal?
Other than a big thank you to everybody. That was the
All right.
last slide.
All right, this was a
Quick
great
question, to get the conflict of interest form back to you, Jamal. Did you tell us how to get it back to you? I wasn't clear that it was fillable online, but I can maybe figure it out.
Yeah, so the form is fillable. So members
Okay.
can sign that and send that directly back to me, and I'll route it internally.
Okay,
One
I'll
other
figure it out.
Yeah, and I'm happy to work with anybody offline in terms of what's going to work best to get that back to the council. One other quick note about that. So all members are required to complete an annual conflict of interest training, which we do have a short video that sort of qualifies for that training that I'll be sending around to everybody. So if folks can keep an eye out for the training video and take a look at that when you have a chance, we'd appreciate it.
All right. Thank you, everybody, for turning up today, and we will see you next month.
Thanks
Take care,
all.
everyone.
Thank you.
Bye.
Thank you. Bye, everyone.
Bruce, are you still there?